Hello, everyone, and welcome back to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I am joined, as always, by man of the hour, emphasis on the fact that he's a man,
I'm definitely a man.
Dr. Jason Martin. How you doing, Dr. Martin?
Good. I'm really good. Thank you so much.
That's good. You were excited because today we're talking about surgery for men, and you wanted me to ask you questions.
Men don't have a lot of things for them, right? I mean, when they get older, they tend to not focus on things for them. Women are better like that. They have
Self-care, you mean?
yeah. Self-care kind of stuff. So like, I guess we have like shave clubs, men have that.
Yes, the hair club for men.
You have golf clubs. There's not much for men, and I think that it does a real disservice to men because I'm going to tell everyone a little secret as a man also. Men care about what they look like. Now, they may not vocalize it. Shocker, men struggle emotionally to express things. But
those emotional feeling
right.
kind of things.
No, I'm not saying they would act on that feeling, but men, as do women.
I'm going to feel this. I'm just not going to do anything about it.
Exactly.
I'm going to keep this feeling all to myself.
They absolutely have a desire to look better. Now, does that mean they have to do surgery? No. A lot of men that come in our clinic, when they are wanting to look better, we tell them that diet and exercise is probably the best way to do that. But there are some things that we do specifically for men that are very easy to do, low risk, and they have great outcomes. So surgery for men, cosmetic surgery for men basically is what this is about, is a really good topic because at the very least, if there's a man out there who's wanting to look a little bit better and consider surgery.
No more if you're a woman out there.
Today is all about the men.
If you're a man out there.
I mean, a majority of our practice is women.
It is, yes.
But we have a few
But
men.
perhaps because of miseducation that these procedures are actually applicable to men as well.
Right, so we're educating men.
Yes.
That's what we're doing.
We're mansplaining to men.
We're going to mansplain to men why they need cosmetic surgery.
There you go.
Okay.
Or that it's an option. I think this is a great topic. And we actually did have a person reach out to us through our website, jasonmartinmd.com, looking for surgery for men. And that was his question. Do you do surgery for men?
Right.
Not one specific kind of surgery, just do you do surgery for men? So it sparked in me the fact that we really should address this because I think a lot of men may think that these surgeries are not options for them, and they really are. So
Let's take a look.
away we go. So are men having plastic surgery is the question.
So I know in our practice, it's not a big proportion of the people that come in the door, but it's more than a small amount. Mm-hmm. So in our experience, they are having plastic surgery.
They absolutely are. And the data I was able to pull was actually from 2017. And if you're interested, we do have a couple of slides that go along with this podcast. If you'd like to watch it on YouTube, we are also at Jason Martin MD on YouTube. So pulling the data from 2017, which was the last year that the American Society of Plastic Surgery
Can I stop you for 1 second?
Yes.
So if you look on the YouTube channel, Sarah, who works with us, makes our slides. And this picture is a little bit concerning.
I love this picture.
Okay. If you have to look on the YouTube channel, any man that looks at this is probably not going to come in for cosmetic surgery.
Like, what?
All right, what's going on?
What are you going to do to me?
Sorry.
Yeah.
All right, go ahead, please.
So in 2017, men accounted for only 13% of the total number of cosmetic surgeries. And this is talking about surgery only, not minimally invasive things like dermal fillers, Botox.
But I would put money on it that the minimally invasive, the dermal fillers, and the Botox are probably in the same range.
They're actually a little bit. They're higher
in
than
the
this.
same area.
Yeah.
Less than 25%.
Yeah, that data does
Yeah.
exist. I just didn't pull it for this. So the top 5 surgeries in 2017 for men. Number 1 was rhinoplasty.
Which makes sense because many men break their nose and do funny things to their nose because men are men in some cases. So you would make sense that they would want to correct the problems with their nose. Mm-hmm. A lot of men, as with women, have airway problems. So if you're going to have your airway fixed, your nasal airway, you might as well fix the outside too. Mm-hmm. Okay.
Number 2, so that was 24% of rhinoplasties were done on men. Eyelid surgery, so blepharoplasty is what we call that, was 15% of the surgeries.
We've all seen the granddad with the eyelids that go over his eyeballs. He's incapable of seeing out of his eyes. And he does that thing where with the eyebrows, they put it up really high and it looks like he's straining just to see.
Yeah, or really, really puffy lower eyelids as
yeah.
well as something that men tend to get a little bit more of. Their skin's a little thicker. You get that really poochy lower eyelid look. So it didn't specify upper or lower, just eyelid surgery in general. Number 3, I actually thought this would be higher, was liposuction, and it was only 11% of the total liposuction cases.
And I think that's
men.
part and parcel with our practice, which we do a lot of liposuction. So maybe anecdotally, we see a lot more liposuction than we would maybe the rhinoplasty, even though we do a lot of rhinoplasties. So
yeah, and then gynecomastia, of course, that is something that is for men. It would be a breast reduction in a woman, gynecomastia in men. It was 100% of the gynecomastias were on men. That's number 4.
We have a great episode on gynecomastia.
We really do. That's a great podcast episode. Really, really good. And then number 5, I was actually surprised to see this because I guess in my mind, I don't tend to think of this so much as surgical anymore, but it still is hair transplants. But it was still only 72%. So ladies are getting hair transplants too.
Sure. Ladies can have receding hairlines or thinning hair. So hair transplants work well for them also. Yeah, so the top 3 or top 2 are on the face, which is really interesting. And then the other parts are on the body. So liposuction and gynecomastia, to me, I thought would be higher than the rhinoplasty and eyelid surgery. Gynecomastia, again, you should listen to the episode we have on that. And I want to say it was upwards to 60 to 70%. I can't remember completely. The percentage of men in their lifetime have enlarged breast. So gynecomastia is a real common problem. And that surgery can really 100% solve the problem for you. If you struggle with that, just know that there is an answer. And we've seen a lot of patients in our clinic with gynecomastia who are not overweight, who are fit, and really struggle with it. And there is no answer besides surgery.
Yeah, when it's significant. And one of the interesting things with this list was what I thought was really cool was that they did the total number. So these were the top 5 by total number of men having these procedures, but it wasn't always the top percentage. Like if you look at liposuction, like 11% is really low, whereas there were other surgeries like calf surgery, pectoral implants, of course, that was also 100% men. Calf implants was a really high percentage men. You know, there were some otoplasty was actually almost more men than women. I think
That's
it was
really
54%.
surprising. That's surprising.
So even though there weren't a lot that did it, the percentage of people who had otoplasty was more men than women.
I wonder if prominent ears is more common in that gender.
Well, you can't hide it.
Oh, that's a good point, too.
Yeah,
The hair.
hair. And I think we'll talk more about that on the next slide. We kind of talk
That's
about
why we need
that.
Amy here. She's Dr. Obvious.
I got hair. Well, I got a lot of hair.
Yeah.
All right. So what are some of the roadblocks that men perceive when they think about having surgery?
So as a man, I can tell you for me, I like to look like myself. I don't want to augment myself. I would like to augment my calves. I will admit that, but I won't do that. But other than that, like especially on the face, I would like to look like me. I think women that come into our office, we do tons of facial plastic surgery. They are okay with pushing the limits a little bit to rejuvenate themselves and correct some of the things they see that are maybe not the way they want it. Men are more, in most cases, just want to correct the things that have changed. And that's where I think you get a little bit of a difference in general. Now, I just want to make it real clear. Obviously, I'm saying men, but there's so many different types of men and different men with different viewpoints.
You're not like the Lorax. You don't speak for all men.
No, I do not. And I'm just aggregating every man in together and creating some man who doesn't care what he looks like and goes to a golf club. So that's not the average patient that comes in our office. But in most cases, men in general want they want a subtle change.
I would agree with that. And I think that I am not a man. One of the things that men, though, see more so as a roadblock to surgery than women is it's harder to hide some scars. For women, they probably have more hair or can easily get more hair with hair extensions to hide scars from a facelift. Yes, they have no problem wearing makeup to cover bruising. That's definitely something for men. Like, ooh, what if my eyelids are bruised for 2 weeks? Like a woman can put concealer on, or say I had filler. There are more socially acceptable things that a woman can say, and it's also probably more socially accepted, especially in her friend and family group, for a woman to have some of these procedures done than it is for a man, perhaps.
Why is that?
That's why I said socially. It's our conditioned response to it in our
right. I think
culture.
Culturally speaking, I think it's people expect men just to live with it, and then women, if you want to take care of it, it's okay. I mean, but I don't feel like that's number one fair, and secondly, I feel like that doesn't make a lot of sense. I mean, if we're now in the age, thank God, where things are starting to be equal across the board, that works in both directions. That if men have a problem with something and they're fit and they're eating well and they don't have a lot of medical issues and they want to take care of it, they should. I do get the constraints or the social concern related to scars and bruising. At the same time, I think the reason they feel that way is because culturally people are like, if you're a man, you shouldn't do any kind of surgery at all. Right,
and they probably haven't seen the example. Most women, by the time they get to be 50, have probably had at least one female family member and or friend's family member, somebody that they know well has probably had plastic surgery of some kind. For men, that it's not like they're all out talking to their buddies about it. So a lot of men probably have had plastic surgery.
So
but
I want to bring this
up.
up. So I have, teenage kids. And so I've gone through the whole gamut of sports, and you go to the games and all the dads and moms are there. I've not had a single dad ask me about plastic surgery for men
Or want to show you his.
or show
Yes.
me any kind of plastic surgery.
Yeah.
And I feel like I'm pretty approachable. Okay. I've had almost every single mom ask me about plastic surgery when they find out I'm a plastic surgeon. So that's interesting too. It's almost kind of a little study in society.
No, I'd say that's very true. I mean, even for myself, I don't shout from the rooftops I work for a plastic surgeon, because when I'm not at work, I kind of like to,
Yeah, I
enjoy
know.
my life. But when people do, what kind of doctor? Plastic surgeon. The men who ask me about it only ask me about surgeries for women.
100%.
Never once has one been like, oh my gosh, can you guys could you fix gynecomastia? I
Yeah.
really would love to get my eyes done.
And it's always an unfortunate circumstance because the man who's asking me actually needs surgery because he's got the love handles or something, and then the wife or the woman looks great. She doesn't really need surgery, and then this guy's sitting there asking me about his wife.
Right, what can you do for my wife?
What can you do for my wife? I'm like, and I mean, of course, I don't say this, but I'm like, maybe you should work on yourself first.
Right.
That probably wouldn't give me a lot of friends on the soccer team.
No,
parents.
but there again, that goes back to like kind of where we're at as a society in this moment. It's very socially acceptable for men to objectify women in our culture in certain ways.
Right.
And the fact that a man has no problem talking about his
I
wife
agree.
or girlfriend's physique in front of a stranger at that point is
Okay, but Amy, this
a
is
different
about men.
issue. I know,
This
that's
is
what I mean,
about
like,
men.
That's what I'm saying. Like, that's a different
This
issue.
is the men podcast.
But
Come
one
on,
other.
Nels. Support me.
I know I'm the minority in this room.
Yeah, all right.
One other definite roadblock, I think, specifically for men, is that they get scared by what they've seen. Especially the bad examples of male plastic surgery.
Kenny
in the
Rogers.
media.
So if you look on our YouTube channel, you'll see Kenny Rogers. It's devastating to see him. I mean, I can't even. I'm looking at it right now. It's very difficult to look at.
Yeah,
I'm
and-
sure he looks better now. Things have relaxed over time, but
Yeah.
yeah.
I think though that I think the images of women who have clearly had too much plastic surgery, it's really easy to look at them and be like, well, they've had too much plastic surgery. Where you see a man, even if maybe that's the answer, he's had way too much, a lot of men look at that like, whoa, don't do anything. That's what you're going to look like.
Yeah.
Not realizing that it probably took, upwards in the multiple digits of surgeries to get to that point.
Right.
Where subtly done, well done surgery is never going to get you there.
I mean, Kenny Rogers should have known when to hold up. He should have listened
When
to
to
his own
hold
song.
on?
Yeah.
When to
And
fold
when to
on?
hold him, when to fold up.
when to walk away.
When to walk away. And when to run.
When to run.
Yeah.
Yes.
He should have run.
He should run.
All right.
So but that's unfortunate that there is that social stigma that,
Yeah.
men are.
And I mean, the last thing before we go on from this, I mean, everyone has their own basis of self-perception and what they desire in their life. There are some people that don't mind looking different, and that, God bless them, and that you can
Or
do
want
that.
to look
So we're
different.
talking about
Yeah.
the average person that wants to look natural and normal, that lives a fairly normal life, and that's what they want. And so that's who we're appealing to with this talk today.
So you kind of touched on this, but I think that this is especially important for men because, again, men don't tend to be on top of self-care and or sometimes their health in the way that they should be.
And when they are on top of self-care, it's almost like they're belittled a little bit. If you like, I remember being in college, the one person that lived in the dorm or the fraternity house or whatever, the guy who showered every day and combed his hair and put the cologne on or whatever, they were like, oh, what's wrong with this guy?
Not just like grabbing his Max body spray out of a
Right.
gym bag after they've showered in 4 or 5 days.
So that's one thing I want to tell guys. It's okay to dress up and clean up sometimes. It doesn't hurt.
well, until you
It's not going to kill you.
have your blood pressure checked occasionally.
Yeah.
Yeah. So what are some of the things that we require preoperatively or need to know about a person's past medical history to make them a good candidate for surgery?
Well, first and foremost is what medical issues they have, what illnesses they deal with. Men, unlike some of our female patients, in some cases tend to be, overweight or a little more overweight, so that puts you at risk for diabetes and high blood pressure. Also, maybe some of the surgeries you've had in the past, but more importantly, the medications you take. And if you're on medications that preclude you from having elective surgery, things that thin your blood, things that, maybe even diabetes, if you have diabetes and you're being treated for that, we will probably not do the surgery. So you have to have a pretty clean bill of health to consider doing cosmetic surgery if you're a man.
Yeah.
And a woman too. But
And a woman, but I think that we're talking to men.
Yep.
Men don't know to have their blood pressure checked and get an
Right.
EKG before surgery.
So in most cases, for cosmetic surgery, if you're over 50, we'll have you get an EKG. Below 50, it's questionable. If we're doing an in-office procedure, then and you're awake, and that's a lot of the procedures we do for men, because they always choose kind of a lesser invasive route or an easier route. We sometimes will not get the EKG, but that's just kind of case dependent. A lot of times we'll get laboratory values for surgery, and that just shows if you're going to have a bleeding problem, you know, how your blood sugar is, what your electrolytes are like, you know, if you have all the good blood levels for your blood cells and platelets and things like that. So these are all case dependent, but you will have some sort of physical exam. If you have medical problems, and an office like ours will sometimes send you back to your internist, and they'll work you up even further, especially if we're going to the operating room. Or we'll do some more workup on you. So it's not like you just come in, sign up, pay the money, and you go in there.
No,
so
that's what most men wish.
We're a reputable office will act like real doctors and a real medical staff and do what they need to do before surgery to make sure it's safe for you.
I think the other big one too, we talked a little bit about gynecomastia, and something we talked about this during our gynecomastia podcast was making sure their hormone levels are okay. So it's happened more than once in our office that we've had a man present who's maybe had surgery with us in the past, distant past, or with another physician and has a reoccurrence of their gynecomastia. And in that case, we generally will require they get some type of hormone testing before we'll proceed with additional surgery.
Yeah. And, you know, it's so interesting in plastic surgery because they don't require hormone evaluations for gynecomastia unless you have a certain kind of history. But I wonder if that's going to change. And then the problem is hormone replacement is a little bit divisive in terms of you sit there and kind of go through it, because some people could just do well by losing weight or changing their diet around. I mean, there's a lot of different things you can do besides just taking testosterone or taking a estrogen inhibitor. The cases that you're talking about, these people had a pretty quick and fulminant recurrence.
There's that word again.
Okay, where we knew that they really had a bad hormone imbalance just because of their presentation after surgery. Sent them to a hormone specialist and they got treated. So, you know, I think that just because you have a gynecomastia, don't feel like you have to take testosterone or do these medications, but in some cases you may have to.
Yeah. So one thing we didn't really touch on when we were talking about the top 5 surgeries nationwide for men, what would you say are our top 5 surgeries that men come in for, or the surgeries that we do?
Well, definitely like liposuction.
Well, I think people get a misconception when they hear the word liposuction, because what we really do is body sculpting.
Yeah.
We're not doing like debulking. We're not doing weight loss surgery. Like what we are doing specifically for most of our male patients is like those finishing touches.
Right.
Like those last little bits of fat that just are really persistent or sometimes hormonally driven, you know, like the little bits that kind of show up. So we're not doing like massive full body reducing liposuction on men. It's usually like chiseling out an already good body.
We do higher end liposuction. It's called high definition liposuction. We use all the newer, you know, technologies. We have, you know, good episodes on that, Body Tight. So, but I think that's unique to our office a little bit. So, and then also we're in Colorado and people tend to be of normal weight. So the fat that you're taking off is just that little residual fat that takes them from really good to great. And that's what we do. Those are a lot harder procedures to do. It's a lot easier to take fat off someone who has an ample amount of fat. Unfortunately or fortunately, we don't have those patients. So, and that's a big part of what we do. It is skewed though. I mean, practices are like anything else, right? Like you kind of get into your niche in life. You move to a neighborhood, you get certain types of friends and that kind of thing. It's the same thing with plastic surgery. So we definitely do active, athletic men who really want to push it as far as they can. And it's not limited to age groups. We've had more than a number of men who are over 50 who do these really high-end sculpting procedures.
Yeah, I'd
of
say
the trunk.
Primarily our liposuction patients that are men are probably under 35 or over 55.
Yep.
It's very rare for us to have. I mean, it's
In
a
the
rare
middle.
patient who's 35 to 45 kind of range.
Because that's like the baby, you know,
They're
when
busy.
the babies are born.
Yeah.
Yeah.
It's
And
that
they're
busy
like, oh my
time.
gosh, what did I do here?
That's when they're busy helping their wives recover from a tummy tuck.
Yeah.
But, you know, it is.
They
I think-
sacrifice for their...
That's right.
Yeah.
Yes. So I would say number 2 would probably be gynecomastia, kind of lumped into that 1 and 2, because
Yeah.
we do a fair amount of that, and sometimes it's in combination.
In our practice, we don't get as much of the younger gynecomastia. In that case, if you're someone out there or you have a child or a young man who has gynecomastia, when you're younger, you want to wait a little bit and make sure that it doesn't resolve, because you get these hormone fluctuations through, you know, the transition to adulthood, and they can have this episodic enlargement of the breast, and that goes away. So
Yeah.
In most
What was the thing in babies that you brought up in our gynecomastia episode? The witch's milk.
witch's milk.
Yes.
Yeah, what was that from?
That was from it's residual estrogen from the mother.
Yes.
Yes. The newborn baby boys will sometimes, that's why their breast buds will be
Right.
swollen at
Right.
birth.
Right, and that was considered bad, right? It wasn't considered good.
I don't remember if it was,
the-
I mean,
yeah.
something called witch's milk I would think is
Yeah, it was
bad, but
a little bit disturbing.
maybe it was good. People were weird.
Yeah, I mean, like baby boys are born with enlarged areola and nipples, right? Because they have the estrogen flowing around. So it is the witch's milk, and that comes
Yeah.
out from the
Yep.
Good memory.
I
Anne.
remember. Yeah. I'm listening when you're talking. I listen.
I try to listen when
Yeah.
you talk, but I'm a man, so
Right.
it's difficult
harder.
to listen.
So I would lump 3 and 4 together, which might be kind of surprising to some people in that it's surgery of the face and neck. So whether that's a combination of an eyelid surgery, which is, not as common for men as doing like a neck lift. I think that might be surprising to men to hear that is a pretty common procedure.
Especially in our office.
Mm-hmm.
Again, anecdotal, because I do a lot of facial aesthetics or facial plastic surgery. We do a lot of face and neck lifts for men. But just real quick on men, the facelift part is not as emphasized like as it is on women. It's more like the neck lift. So if you're a man, and you're out there and you're
Out
listening,
there, you're a man out there.
You're a man out there, not a woman, and you're listening, and you want to keep somewhat of a natural appearance, a more male appearance. If you really focus on the neck and less on the face, then you're going to be pretty much guaranteed, with a board certified plastic surgeon, you're going to be pretty much guaranteed to have a real natural and subtle result.
Yeah, and men are fortunate, especially with facial procedures, because your skin's a little thicker and you can grow a beard. Like women may be able to wear makeup, but like men can grow a beard. So like recovering from a face and neck lift for a man is maybe not as involved as they might think it is.
So you're throwing all the Irish dudes under the bus that we've operated on that cannot grow a beard.
You can grow a fine beard.
Oh, please.
You get
It
some.
looks like mange. It looks like I look like a dog that's been tortured for a year.
No, that's just usually because when you don't shave, it's because you're on like the 7th day of trauma call
Yeah,
and
I
have
know.
also not slept in 7 days.
Trauma call. So I think male facial surgery is actually really the dividend from those surgeries is great.
It's really high.
Yeah, it's like, it's so funny because that's the one thing that men really struggle with is like plastic surgery. If you tell them, okay, I'll do some liposuction on your hips, they're like, that's great. Just do whatever you need to do, doc. It's great. You take into the face and neck, that's when really the heebie-jeebies start. And they really get concerned. And in our experience, in my office and Amy's experience, the outcomes are natural and nice, and they just look great.
Yeah.
And in some ways, because of the integrity of the skin, which Amy's
Thicker.
kind of referring to, doesn't matter what your heritage is, men tend to have thicker skin. Their outcomes are better in some ways, especially on the neck, and they last longer.
Yeah, your skin has more tensile strength, more integrity.
We've had numerous examples of operating on the wife and husband
So many.
on the face
Yes.
and neck, and the men come in like 3 days later. It's like
It's like
immediately
nothing
post-op.
happened.
And I'm like, wow, man, you look great. He's like, yeah, thanks, Doc.
Yeah, I feel fine.
And then,
Yeah.
the wife is starting to change a little bit, especially with the Caucasian skin
Black
types.
and blue. One thing that I'm going to just say to all of the men out there who might be considering a face and neck lift, something weird that none of your guy friends are going to tell you because guys don't talk about this after when we pull that flat back over the tragus, you have hair that grows all
Right.
the way over the tragus.
So-
like beard hair.
Right. In some cases,
Mm-hmm.
you won't have that. In some cases, you will. The old days, and even current days, some people still do is put the incision in front of the tragus, that thing in the ear that Amy referred to in the otoplasty episode as the thing you push down when you don't want to hear your kids. See, I listen to what you say.
It's the I can't hear you.
I
thing.
don't want to hear you.
Yep. No.
So sometimes you'll do the incision in front of that, but then it's visible. So you can do hair removal if you do have hair growing on the tragus. You can shave
Laser.
it and cut it and
Most,
laser.
most guys just shave it. I mean,
Yeah.
not to throw most men under the bus, but by that point, by the time they're in their 50s getting a neck lift, they probably are using that little ear buzzer thing anyway.
The one that you bought me.
Yes, the one that
Okay.
I bought you, because I have to look at your ears.
It's demoralizing.
I mean, if
I get it from
seriously-
Amy. I go home and get it from my wife, my kids. Everyone's like, "You got hair growing? What's going on?" I'm 45.
Well, I'm at least I was like subtly honest with you.
That's a good point. So to be honest, you gave it to me as a Christmas present.
Birthday. It was
Okay,
your
birthday.
It was your birthday
Even
present.
worse.
And to be fair, you opened it and showed it to the one other guy in our office.
Yeah.
Yes.
It was awesome.
Like using it in front of him. It was a good time.
It also works on your eyebrows, by the way.
Yeah, just be careful. Don't Mona Lisa yourself.
Yeah.
All right. So next, if you are watching this, we have a great picture to show. And this is a before and after of a gynecomastia and kind of chest sculpting procedure that Dr. Martin did. And it's pretty remarkable just kind of to show like what an amazing change you can get.
And what I also like about this picture is that plastic surgery, and I'm speaking to the guys, is about empowerment, okay? So if you do these surgeries, it's about changing your life, right? It's about making you have a better life, making you feel better. And what does that do? How does that translate in your life? Well, shocker, if you feel better, you're going to work out, you're going to eat better. I mean, it's been shown, proven from science data, and also anecdotally with all of my patients. This guy was struggling with gynecomastia, had some hormone issues, got those fixed, and then was motivated to work out and do what he needs to do. So if you look at these pictures, not only does he not have gynecomastia, he's all jacked now. He's got deltoid caps and
He's super jacked. He was an athletic guy to begin with, but
right, he got into a bad space, as many men do. Middle age, you get into a bad space.
Yeah,
you know?
teenage kids.
Yeah,
like,
he was
same thing.
he's working, stressed. Maybe he wasn't eating well, and he changed his life around. Did the gynecomastia, and let's be honest, this patient specifically, and most men, he's not going to be showing this off. He's not going to the pool showing everybody his new breast, okay, or his chest. Excuse me. It's not happening. But for him, he feels better. He feels more masculine. He feels confident. He can go out, and that's a big part of what we do for cosmetic surgery. And that men and women should equally feel that way. That's what this is all about. So that was a good speech.
It was very
We
good.
should record that.
We did. We just did.
Yeah.
That just happened.
Okay, that just happened.
That just happened.
Just put that on a loop when people come
Yes.
in. You know, I think that, you know, we have tons of pictures of men. We don't have as many on our website. Men are a little bit weirder about showing the pictures, but a lot of men maybe don't agree to let you put it on the website, but they will agree to let you show as many patients as possible in the office. But it is transformative. And it is interesting being a man who does the surgery with primarily female coworkers in the office, female nurses in the OR, female scrubs, and then female patients. Every now and then I get the guy that comes in, and I'm like, this is great. You know, thanks, man. Thanks for coming in.
Yeah.
And I tell him, it's like, don't worry about it. It's going to be good.
And it is. And the one other thing I think we just should throw in there, we were talking about the most common procedures for men, but most all surgeries are available to men. I mean, we've done medial thigh lifts, we've done tummy tucks, penniculectomies.
The one thing, and you know, this whole episode is not about what are male plastic surgeries, and we'll do another podcast or another episode on that to explain the surgeries we do for men. But a big portion of our male patients, a big size or a big percentage, are weight loss patients. And that is getting more and more common these days in America because obesity is just prevalent, and people are getting a lot of these gastric bypasses.
Or just losing it on their own.
Losing on their own. So, and that's a whole subset, and that would even be a great episode, just, you know, post-gastric bypass or bariatric surgery, plastic surgery for men, would just be, that alone would be a great episode. This episode is just really about saying that if you're listening to this and you're married to a guy, or you have a friend or whatever, significant other, whatever, and they're concerned about doing plastic surgery, but they have a real problem, tell them it's okay. Tell them to listen to this episode. Say that you're not alone, right? There's tons of men out there who struggle with something of their body that they don't like. And if you can do a surgery that's safe and easy, effective, and with proven results, why not?
Yeah, the options, all the options are there. So for men, like there's really no surgery we can't do that we could. If
Right.
you are a human out there and there's something about yourself that you don't like, we can probably fix it.
Body lifts,
Yeah.
brachioplasties. I've never done that in a man, but I mean, 100% you could have a bariatric patient that would need that.
Have we never done a brachioplasty on a man?
Man, nope.
Really?
Maybe one.
I feel like we have.
One.
I'm like, there have been a lot of. Sorry.
I feel like I've done everything on everyone, so
Yeah,
I
that's
guarantee
kinda
there's
like-
something.
I feel like there absolutely has been one, but well, either way.
Okay.
Either way, it can be done.
It can be done.
Yes. So I think that was a good episode.
Yeah. And I want to personally, you can, if you're a man listening to this and you have more questions, you can email me, but I don't answer my email, so email Amy.
Email me.
Amy at JSmartinMD. You can talk to her. Also, please rank and rate this podcast. It keeps increasing in popularity. It's blowing up, Amy.
It only does that though if people like comment and share us.
Right.
So please share us. Be sure to check us out on other social media platforms. We're at Beauty and the Surgeon on Instagram.
And then Nils just informed us that our YouTube channel, which we've talked about before, is really growing too. So you can check that out. If you don't like to listen, I personally like to listen to podcasts as opposed to watch them. I'll even put the YouTube on, put it in my pocket and listen to it, which I'm like, I'm not sure how this is helping the podcast because you're taking away from their podcast listens, but you're watching on YouTube. That's okay.
Either way.
Yeah.
Thank you everybody so much.
And we'll see you next time.